Today on Investigate TV Plus, a woman says pushing back on her doctor's diagnosis saved her life. We take an in-depth look at how often diseases are misdiagnosed and why experts say women are most at risk.
Plus, a national doctor shortage leaves many Americans waiting for care they desperately need.
It took like almost a year to get in.
We examine the root of the issue and reveal some solutions.
Then, the drive to succeed, the challenges this golfer overcame for the love of the sport. In-depth stories that inform and inspire. You're watching Investigate TV Plus.
We trust doctors to tell us what's wrong when we're sick or in pain. I'm Lee Zurich.
And I'm Tisha Powell, but some doctors can get it wrong. As many as 12 million adults in the U.S. are misdiagnosed every year, but women bear the brunt of that statistic. They are 20 to 30% more likely than white men to be misdiagnosed, and in some cases, the mistake can be deadly.
Investigative reporter Kristen Crowley takes a closer look at the problem and what steps experts say you should take to avoid a misdiagnosis.
Every story has a beginning and an end. For Allison Lackey,
I'm cancer-free now, and it could have been a very different story.
she nearly missed out on that happy ending, all because of how her cancer journey started. To understand what happened, let's go to chapter 1, beginning with her doctors.
What did they tell you when they diagnosed you?
And my sisters were both in the room with me when the oncologist comes in and tells me the pathology report that, yes, triple negative.
Diagnosis: triple negative breast cancer.
Triple negative is very serious.
Yeah, the survival rates of people with triple negative versus not triple negative, yeah, there's a definite more serious diagnosis when it's triple negative.
Allison's next step became almost like a choose-your-own adventure. Go forward with the specific chemotherapy for triple negative breast cancer or get a second opinion. She chose the latter.
Looking back now, what are your thoughts on deciding to get that second opinion?
I thank God I did every day.
Chapter 2, that second opinion at the University of Kansas Health System, changed the course of her story.
Were you triple negative?
No.
It was wrong.
It was wrong.
Allison had breast cancer, but since it wasn't triple negative,
That's a very different type of chemotherapy regimen.
Allison's doctor, Jamie Wagner, says had she been treated as triple negative, the chemotherapy likely wouldn't have worked. Allison might still have cancer today, and her case is not unique.
How often are you seeing that the initial opinion got it wrong?
Specifically for breast cancer patients, 43% of them will have a change in their diagnosis and treatment when they get a second opinion at NCI designated cancer center.
Almost half.
Yeah.
The problem with misdiagnosis isn't just with breast cancer. A 2022 study found stroke, sepsis, lung cancer, and colorectal cancer were among the most misdiagnosed conditions. Johns Hopkins estimates nearly 800,000 Americans die or are permanently disabled by diagnostic errors every year. And the statistics are dire for women, who are up to 30% more likely to be misdiagnosed.
How does a misdiagnosis happen in the first place?
Lots of studies across all of medicine has shown that those that have higher volumes, specialty training, their eye just becomes attuned to small nuances that maybe somebody else, they just haven't had the experience.
For example, specialists in cancer, infections, or neurology could recognize something a primary care or family doctor might miss. There's also gender bias. For centuries, clinical research focused on men, even though certain conditions can affect men and women differently, like heart attacks. One study found women experiencing chest pain waited 11 minutes longer for help in the emergency room versus men with the same symptoms. Allison Lackey's wait for the correct diagnosis
I was able to see the oncologist, the breast surgeon.
came within a few weeks. But for Sarah Allison,
How am I standing here with this diagnosis that I asked you about for 10 years?
it was much longer.
My migraines changed from like being very responsive to migraine meds to not being responsive really at all.
She says she pushed her doctors for years to look deeper. Their response?
He just said, no, Sarah, it's not. There's no way. It's migraine. This is typical for migraine.
Even when things started to get worse.
Changes in vision, falling over, weakness, trouble with my hands, pins and needles, neuropathy.
She says her doctors still blamed it on migraines. But it wasn't a migraine. A second opinion 10 years later determined it was multiple sclerosis, an autoimmune disease that can be managed, especially with early treatment. Sarah missed out on years of that.
I feel like I was kind of dismissed at every turn.
And that medical malpractice attorney Robert Kingsland says is at the core of the issue.
Often it's the case with failure to diagnose and failure to make a timely diagnosis. The patient will have a feeling they weren't really listened to.
Kingsland has worked on failure to diagnose cases for about 20 years with his firm Dempsey, Kingsland & Osteen in Kansas City. He says he gets roughly 3 to 5 calls a week from people asking him to take their case. Typically, he says the failure starts with the primary care physician not recognizing a condition outside their expertise.
If you need a specialist, it's the primary care doctor's responsibility to understand that need and get you to whoever that might be.
That's why Dr. Wagner says whenever a patient is in doubt about their medical treatment or diagnosis, to ask questions, search for a specialist, and...
Do you encourage people to get second opinions?
Absolutely.
Even if you're the first opinion?
Absolutely. Yes.
For Sarah and Allison, second opinions changed the course of their stories. Stories they hope help other women from being misdiagnosed.
Dr. Wagner says when looking for a second opinion, try to find a health system with equal or better quality than the first one you saw. For example, if you're experiencing back pain or headaches chronically, you may want a neurologist because they specialize in those areas. And Wagner says, don't be afraid to get more opinions than just 2. You should feel like your doctors are listening to you and taking your concerns seriously.
It's not just women who face discrimination at the doctor's office.
A 2023 survey revealed nearly 20% of Black adults and 10% of Hispanic adults experienced unfair treatment in healthcare compared to just 3% of white men. And for women of color, the statistics are even worse.
Experts say there are things you can do before your appointment to help ensure you're being heard. The Society to Improve Diagnosis in Medicine recommends you have your medical history on hand, monitor and record your symptoms, and make a list of what you'd like to address with your doctor.
Still ahead, scammers are stealing billions from Americans. How a sheriff's deputy turned the tables and made a fool of a fraudster.
But first, the medical system faces an emergency of its own, a doctor shortage. We examine some solutions and show how patients are already paying the price. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
Healthcare is critical to our well-being, but for many people across the country, seeing a doctor has become a challenge. The Association of the American Medical Colleges estimates by 2036, the U.S. will face a shortage of up to 86,000 physicians, and patients are already feeling the consequences. A South Carolina man felt that shortage firsthand, and for him, it's painful.
Reporter Carrie Beal shows us how everyday life can be difficult while waiting for a doctor.
Robert Brzezowski of West Greenville says simple tasks like walking around his yard are now a daily struggle.
I got it.
Due to his age, he needs a hip replacement. But he had no idea how hard it would be to get one in Greenville.
Well, it took like almost a year to get in.
Diane says she's also been waiting a year to get a skin issue checked since moving from Anderson.
I think that's crazy. I think they got to do something because I mean, like I said, there are people that are really suffering bad.
It's going to become a national crisis. It's already leading in that direction.
The dean of the U.S. School of Medicine Greenville, Phyllis McGilvery, says there are multiple factors at play. She says baby boomer physicians are aging out faster than they are being replaced. The high cost of medical school is deterring some students, and there are not enough residency spots.
The residency programs are really the barrier to helping address our physician shortage. We have to get more board-certified physicians trained through residency programs to make that happen.
The dean of the College of Medicine at MUSC, Terrence Steyer, says Medicare funds most residency spots across the country.
So as we look at the physician shortage, the number of medical school graduates has actually increased by about 20% since 1997, but the number of residency positions has pretty much stayed the same.
Medicare added 1,000 new resident spots nationwide recently, but school leaders say that's a small fraction of what we need, and medical school graduates are now left waiting.
Until that expansion happens, a lot of our medical students have difficulty getting into residency, depending on what they're trying to get into and how many residency spots are open in that particular field.
For Diane and Rob, they're counting the days until his treatment.
He shouldn't be sitting around that much. You know, that alone's not good.
Oh, God, that hurt. Yeah.
He needs to be moving, but he can't.
Hard work.
In an effort to address the problem, the Medical University of South Carolina created an accelerated program where students graduate in 3 years instead of 4.
It doesn't shorten the length or the amount of time of training that they require. What it does do is basically take away all of their vacation time that they would normally get during those last 3 years of training.
In 2024, several universities and medical systems announced new residency programs in an effort to address the shortage. A move that makes sense, as more than half of physicians stay to practice in the states where they completed their residency.
Coming up, the only way you lose is if you don't take a swing. This teen's inspiring journey from her hometown fairway to representing Team USA.
Plus, scammers use fear to pilfer money from victims. We'll tell you how you can keep your cool under pressure if you get a phony phone call.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms.
During the first half of 2024, Americans lost more than $1 billion to imposter scams.
An Oregon man's professional background tipped him off, and he's sharing his experience to warn others.
Investigative reporter Ezra Kaplan sat down with an expert to find out how his department is working to combat the con.
Deputy David Huey was on duty working a public safety fair when his phone rang with an unknown 503 number.
I didn't recognize the number, but I was a little suspicious just kind of going into it, with my background in law enforcement.
He quickly realized it was a scam, but decided to play along and record the conversation.
I'm Deputy Wells from Washington County Sheriff's Department. Following regards of a legal matter, my badge number is 0934, sir.
The scammer told the actual deputy that he had missed jury duty and that there was a warrant out for his arrest.
That panel selection was actually scheduled last Monday, sir. You actually missed that panel selection.
The scammer knew the deputy's home address and used his wife's name when saying that she had signed for the original summons. They said he needed to go to the police station, listing the address of the sheriff's office where Huey went to work every day. And they said, whatever happens, don't hang up.
And what we have is OCC, sir, open line of constant communication, sir. We actually have to stay on the phone until you actually made it into the department, sir.
Every single one of those calls is fake.
Detective Patrick Altier leads the department's efforts to combat scams and says that the call follows a pattern where the call ends with a request for thousands of dollars to make it all go away.
They are saying all this with very great confidence because they know that people fall for it a lot. Give me money or go to jail. And so people go, whoa, I don't want any part of that. Yeah, I'll get you. Just hang tight.
So it sounds like there's an urgency, but what we really should do is slow down.
Slow down. Slow down. Hang up on them. call back.
Because the reality is, once the money has been sent, it's almost impossible to recover, even if you report it to the police.
And by the time we know about it, and by the time you realize you've been scammed, your money's gone. It's gone.
Almost all the scams involve people working abroad, and it's outside the jurisdiction of local law enforcement to pursue money overseas. In the meantime, his belief is that the best offense is a bulked up defense.
If the way we stop these scams at a local level is through education. We stop the people giving the money because we won't stop the scammers. We don't have the power to do that.
Back on the phone, Deputy Huey was transferred to someone supposedly higher in command.
Yes, sir, this is Captain Carter. I'm with the sheriff's office, sir.
After 10 minutes of playing along, Deputy Huey was done.
Just out of curiosity, how many people fall for this scam?
Quite a bit more than you would think so.
I learned these are most often big scam organizations, and many times they're overseas. Unfortunately, that's out of law enforcement's jurisdiction, so there's not much that they can do. But they can collect data, which helps them better understand these scams. That's why reporting them is important. Law enforcement officials tell me that reports help them better identify patterns, and they can request more funding for public education. If you've been the victim of any scam, you can report it at reportfraud.ftc.gov.
Still ahead.
I'm glad that I get to share my story and kind of inspire the next generation of kids who have disabilities.
A new perspective for the love of the game, what almost kept this teen off the golf course, and how her perseverance paid off. Whether it's hitting the course or a round of putt-putt, millions of people play golf.
A teen who found a talent on the green says she almost had to quit the sport when she lost her vision.
Reporter Mark Carpenter shows us how her drive and positivity kept her on the course.
When Amanda Cuna steps onto a course, every swing is the product of pure instinct. A natural feel for the game that's taken years to achieve.
I'd take her to the driving range with me to get her out of the house. She was probably 4 or 5 years old. I just gave her like a little children's club and just let her hit some balls so I could do my own practicing. A little selfishly, but then yeah, she started picking it up pretty quickly from there.
Cuna would become a star on Hawaii's junior golf circuit before joining the team at Les Jardins. Then, in the summer after her junior year, her vision started to blur.
I was driving at this point. I had my license for 6 or 7 months now, feeling really independent. And then I remember the one morning, I was driving, noticed something was off, and then told my mom, and we ended up going through months of eye doctor appointments, trying to figure out what was going on.
And for her family, a months-long, agonizing fear of the unknown.
Then they thought, oh, it was some type of infection. So you're not too concerned at first, and then her eyesight got worse pretty quickly. And then they just didn't know what was going on.
I would be taking her to her doctor's appointment, and I'd be crying, and she'd be sitting here going, "Don't cry, I'm still here." And I'm sitting here going, "I can't, you're my kid, you know? What do you do?" We didn't know anything at the time.
It wasn't until they visited specialists on the mainland when they got the diagnosis, Leber hereditary optic neuropathy, an extremely rare disorder that results in loss of central vision. Cuna can see somewhat based on her peripheral, but is legally blind. She thought she would never be able to play again, yet refused to quit.
Golf has always been that one thing that I didn't stop doing. I would say having something that was the same through my whole vision loss was important to me. Obviously, there were my friends and family, and everyone was very supportive of me, but having something that I had to myself was really important.
Cuna competed in her senior year at Les Jardins and is believed to be the only blind golfer to play a full ILH season. And her condition didn't rule out college sports, as she's the leader of the University of Arizona's adaptive golf program.
So I'm really thankful for almost the 10 years that I had playing golf before losing my vision. I I have those muscle memory skills. I have, I know how to play my game.
And throughout this process, the support of Cuna's parents and coaches has been critical.
What do you see right now in front of you?
Like a giant oil spill, like kaleidoscope. I see like those batch of dark trees, I think pine trees out there, and I see the mountain line, like the outline of it. So that's pretty much it. I also see part of the range where there's like the slope down the hill. So like we'll use those different slopes and angles to kind of like line me up.
Her dad Larry is her caddy and her eyes.
Give me a line. Where's your line?
That bottom corner of the mountain.
Okay.
That good?
Yeah. That looks good right there.
It's been really rewarding, and I'm glad that I get to share my story and kind of inspire like the next generation of kids who have disabilities, and for them to know like that this is a path that they can take, because I sure didn't know that.
It's an unknown and it's scary, but she pulled us through it. Just because you have a disability doesn't mean you stop there. You just go out and see what's out there open for you and live your dream.
And don't be afraid to take your shot.
It's just amazing what she can do, and I like the way she described her muscle memory, because she had been doing it for a while and she just kept on going.
Yeah, she said she valued those 10 years, but I mean, her outlook on life and everything is a lesson for anyone who faces adversity, and we all face some type of adversity for sure.
We can all learn from her.
Yes, we can.
Well, that's it for us on Investigate TV Plus. I'm T. Chappelle.
And I'm Lee Zurich. Thanks for watching.
On the next Investigate TV Plus, newer cars or computers on wheels collecting your personal information.
The auto industry is hiding what they're doing. Where there's smoke, there's oftentimes fire.
We analyze the policies for major automakers and take a look at what you can do to protect your privacy.